Good afternoon. I'm John Cleveland, Center Director at Moffitt Cancer Center. We're here at AACR 2023, an amazing venue for the best in science and the brightest minds. And here with me today is one of our brightest from Moffitt Cancer Center, senior member, Dr. Heiko Enderling. He's in the Department of Mathematical Oncology and is a member of our Cancer Biology and Evolution program, which is really a unique program for any cancer center. And he works in probably one of the most unique departments in any academic department in any cancer center in the United States, the Integrated Mathematical Oncology. And Heiko, you've been with us now for what, a decade?
10 years, yep.
10 years, and he studies the interplay of radiation and neoadjuvant therapy and modeling this to come up with the best kind of approaches for therapeutically treating our breast cancer patients. It's one of his current focuses. Do you want to talk to us about that?
Absolutely. Thank you for having me. It's a pleasure to be here. So we do what we call quantitative personalized oncology. We try to develop mathematical models that use patient-specific data to predict forward in time how does an individual patient respond to the treatment we want to prescribe. And if the predicted response is not good enough, we can ask what-if questions. We can build digital twins to run clinical trials on the computer until we find the best treatment for each patient and then personalized treatment with the best outcomes.
So yeah, have you been actually able to now translate this into a clinical trial at Moffitt or at elsewhere?
Right, we do have a couple of clinical trials at Moffitt that use evolutionary therapy. We try to understand evolutionary dynamics of cancer resistance, predict when do individual patients develop resistance, and how can we prevent that? How can we act ahead of time such that resistance does not develop, and how can we delay negative outcomes and prolong time of response. We have some clinical trials in prostate cancer. We recently finished a clinical trial in radiation oncology where we use patient-specific tumor growth dynamics before and during treatment to personalize what is the dose a patient gets, what's the dose fractionation the patient gets to really not only improve response, but also limit side effects of radiation.
I mean, yeah, this is going to change patients' lives, right? In terms of their outcomes and, reducing side effects. This is going to have a tremendous effect. So
we hope so.
I applaud you and your team for your work. I think it's really moving medicine to the next level about how we should be treating our patients. And it's exactly one of the most innovative things that we've got cooking at Moffitt. We're tremendously proud of your work.
Thank you, sir.